Of course, things are opening up again today. I'm just wondering, are you concerned about any of these queues that are forming outside of places? Everyone's hyped up about going out again. Is this a concern to you?
It feels like a big day and lots of things opening. It's a big list: tourism, non-essential retail, hospitality, gyms, swimming pools. So I'm excited. I think the rest of the country is excited, but I would ask everybody just to be careful, like they've been in the last few weeks and months. So don't get overexcited. So wait your turn. If it's too busy, maybe go back tomorrow. The shops will still be there. The shops will still be open. So don't go crazy right at the beginning. But I think it's important. I think it's important that people can see their pals, can see their families, and we can get the economy started.
Yeah, I mean, I suppose, is there any concern there that, of course, these things have been able to open up slightly earlier than expected, and because there's low infection rates, but with things opening up, and there's a fair amount of things opening up all at once. So is there a concern there that this might actually see a surge in cases?
There's always a balance, and the public health advice is only part of that advice. We've also got advice from economics, and the politicians get to make the final choice. But we are confident as public health professionals that we're at the right point for these openings. And then if we wait 3 weeks, we're hopeful that the next set of openings can happen, but that'll depend on everybody's behavior. We've launched today 2 things that will help. We've launched an app for checking in hospitality and venues, and we've launched testing for every member of the population. So you can now do twice weekly tests that will just help protect you, your loved ones, and the rest of us.
Just in terms of course, in India, we're seeing a massive surge at the moment, and in some areas of the UK as well, there's some other variants. In Scotland, is there any concern over these new variants, and what's going to be done to make sure that these are kept low if they do come?
Yeah, variants are a concern. The principal problem with the Indian variant is, of course, what it's doing to India, not what it's doing to us. The pictures online and talking to friends of mine there is just awful. The way to keep the virus down in Scotland is, of course, our individual behaviour, but also dealing with the border. So stopping importing new variants from wherever they are in the world, be them European or Asia Pacific or wherever they come from. And we've done a relatively good job of that so far. We need to keep that going. We need to keep monitoring it. But as we open, we need to be very careful, because you can see how quickly this virus can spread.
In terms of when people will be able to travel outside of Scotland, even just to other areas of the UK, what measures are going to be in place there?
So that's allowed from today. So you can travel to England, Wales, and Northern Ireland from today. You have to, of course, check your destination restrictions. And you can also travel to parts of the common travel area. So the Isle of Man, for instance, is now open. Broader travel internationally, I think, is a few weeks and months away, and we'll need to watch that very carefully. We're trying at a 4-country level to do that. The twice weekly testing is part of our protection to help each of us to do that. And I would commend it to people that they should do it. Remember, a lot of people who have this disease don't know they've got it. They have no symptoms. So it's just another layer of protection on top of what we already have.
The indoor and outdoor venues, of course, only alcohol outdoors, but restaurants can be open indoors, which is different, a different approach to other areas of the UK. I'm just wondering, what is the kind of theory behind that?
So our theory was to allow things to open gradually. So for 3 weeks, you can't have alcohol indoors. But on the 17th of May, all being well, we will be back to later openings and alcohol indoors with dinner. But for now, the daytime hospitality trade can be open. So cafes can open for people to perhaps meet with community-based pals or family that they haven't been able to see for months. And in the evenings, they have to close a little bit early, and no alcohol indoors. We know that indoors is more dangerous than outdoors. So we just wanted to do it in steps, just so that we can follow the data and make sure we're not going to see a surge in cases that would make us go backwards rather than forwards.
Yeah, because I mean, alcohol is one of those things, isn't it, where everyone has a couple of drinks and then people get a bit closer together, they're hugging each other and that kind of thing. So, is that one of the reasons for this earlier closing? And is there any concerns there that might also lead to some spikes?
It is. We know that indoors is more dangerous. We also know that if people know each other, it can get a little bit more public health danger. So lubrication with alcohol can also make that a little bit worse. That's why we're a little bit worried about social events, particularly indoor social events. And that's what we're doing. We're trying to do this gradually. So people's behavior now will count for the openings in 3 weeks' time. So if we don't go crazy now, then in 3 weeks' time, we're very hopeful that we'll be able to open a little bit more. We'll even allow perhaps people to mix inside each other's houses in small numbers, which would be fantastic for families.
And I'm sure that that the data will kind of guide everything. But what happens if in a couple of 3 weeks, 4 weeks, you start seeing that the cases are starting to rise again? What measures are in place to protect people there?
It would depend on the scale of that rise. If we saw exponential growth and things went out of control, of course we would advise more restrictions, because this virus is still very dangerous. You don't have to look very far to see this virus really taking a toll on people. Vaccination in Scotland and the UK is going very, very well, and that's protecting a lot of people from serious disease. But young people are not vaccinated yet in the main, and they still need our help to keep them protected going forward. So we can go backwards. I'm very hopeful we won't have to. The population has really done well to get us to this point, and I'm hopeful with vaccination, behaviours, and test and protect, we'll be able to keep going.